Dr. Gregory Johnson. We have Josh here with us this afternoon, and Josh has come in here because of a idiopathic scoliosis, and that's not some idiot diagnosing scoliosis. That just means unknown cause, and that was done by an orthopedic surgeon here in Houston, right?
Yes.
Okay, so there are two types of scoliosis. There's a functional scoliosis and a pathological scoliosis. Functional scoliosis is where there's just aberrant biomechanics and misalignments in the vertebrae of the spine and the pelvis from postural distortion, sleeping wrong, sitting wrong, standing wrong, bending, lifting, twisting wrong over time. And then the spine starts adapting to that and creating curvatures in the spine from the A to P or front view, which is more like a snake looking view. That's the scoliosis. That's a functional scoliosis. Those can be corrected a great deal. Josh happens to have a moderately severe idiopathic scoliosis. We're ordering some new digital x-rays on him to get to the bottom of it. I've already looked at the ones they had taken previously, and they don't satisfy me because they're full 14 by 36, and we get sectionals, which are more diagnostic in nature, 14 by 17s. But so long as we don't see a birth defect or a hemivertebra, which means the vertebra is kind of at a wedge angle, which causes all the other vertebrae to then deviate from that, that's a pathological scoliosis. I can't, as a chiropractor, nor can any chiropractor, do anything to straighten out a pathological scoliosis from a birth defect like that. Or compression fractures, malformed vertebrae. Birth defects are the most common cause, but Josh did not appear to have that in the x-rays that I looked at, but we're taking some more diagnostic studies on him to evaluate that further, and you're getting those done tomorrow, right?
That's correct.
Okay, we'll be going over those with you when we get those. But I want to show you what we've been doing that's been helping him already so far. So let's have you close your eyes for me, Josh, and bend your head forward and backwards. There's a lot of people out there in the world suffering from scoliosis. Some of them don't even know they have one. You can have a scoliosis that's functional and not even have pain, or you can have a very minor one and have severe pain. So it just really varies per individual, or you can have a really moderate severe one like Josh, and he's 17 years old now, and he's lived through 17 years of it developing, and his bones aren't even fully grown and ossified yet. That doesn't usually happen until after the 18th year. So they wanted to put Harrington rods in your spine, didn't they?
Mm-hmm.
Which is rods that connect and fuse the entire spine to try to straighten it out. But for his age, that's insane because his bones are still growing. And just because he's got a rod in there, that's not going to help his flexibility or movement at all. So what we're doing is we are still treating the 24 freely movable vertebrae in his spine and pelvis. And the first thing we're going to do on him is your favorite, ring dinger. So we're going to lay you on your back here. Now on Josh, because he's 17, I do the manual spinal decompression a little differently than I do on adults. It may look the same, but it doesn't feel the same. Put him in there good and tight. He usually goes in the last couple of pegs there. That's good. There we go. Feel in there tight?
Yeah.
Okay. We still raise the legs up to where they're parallel with the floor. I know we need some WD-40 on the table, so don't get on Joseph about that. Or Renee. You can get on Renee about it too. Okay, there we go. That didn't make any squeaking noise. That's good. Now, we're going to wrap this wet towel around his occiput and his mandible. Okay, take another deep one. Let it out through your nose and relax. There we go. See, it was more of a traction pull, and I just did a slight high velocity, low amplitude thrust at the end. Did you feel that all the way down?
All the way down.
Yep. So we still get the same kind of movement, but you have to really feel every individual patient's ligamentous play or range of motion. You can't just sit back and pull as hard as you can on everybody. That's not a controlled adjustment. Just like right now, I am feeling his range of motion and his range of motion in the cervical spine joints from C1 all the way down to C7. And we adjusted all those on the cervical rotary brake Palmer method. Okay. Now we're going to have you lay on your tummy here first, Josh. Now before we got started treating Josh, he was having moderate severe pain in his low back every day, weren't you?
Yes.
And it was making it hard for him to sit in class at school. And you can see his left leg is still coming up short about 1/4 of an inch. And it gets longer when I bring it up, and that tightens up in your low back right there, doesn't it? Not as bad as it did the first time, but still tightening up. Right there is tender. Now, as you can watch my hands here. Actually, I'm going to pull your shirt up if you don't mind. And you might find it. There you go. Good. So you can see the curvature right here. The convexity of it goes out to the right in the upper thoracic. Right here in the thoracolumbar, it comes over to the left side and then down into his pelvis. And you can see the right side of his pelvis is a little elevated over to the left side. So what we're going to do is we're going to bring his spine more into a straightened position here. And we're going to adjust his pelvis and SI joints first. And I'm not sure which less than smart person said that there were no nerves coming out of the sacroiliac or sacral region on one of the videos that we did earlier. But there is a ton of nerves that come out of the sacrum, the SI joint region, and the coccyx that feed into the lumbosacral plexus and the sciatic nerve. In fact, the majority of them coming out of the pelvis and the sacrum. Some know-it-all thought he would bring up that the sacroiliac doesn't even have nerves coming out of it. Well, that's just absurd. There we go. The reason that we get these difficult cases like this is because I do know what's going on with spines and nervous systems. That's been my entire 36 years of graduate and postgraduate educations in neurophysiology, biomechanics, biophysics, neuropathophysiology, biomechanical and biostructural diagnosis, treatment, and rehabilitation. And I go to postgraduate education seminars every year to increase my continued skills and knowledge in that area. Now that was a little easier that time. Still a little short on this left one, so we're going to still hit that left hip eye again. You know, the proof is in the pudding whenever you're getting adjusted in these areas. Now on this side you see the convexity is more on the right, so I'm going more right to left up here. Okay. There we go, right there. Now I'm going to pop your head piece up a little bit. Okay. Now we're going to put his lateral cervical curve back into a forward 63-degree radially loaded arc, which is a cervical lordosis. There we go. Okay, let's turn that back now. We've already done his master cervical rotary brake, so now I'm going to continue to put the cervical lordosis back into his cervical spine by bringing his head up and extending his head backwards so we can bring his ears over his shoulders. Let's slide down a little bit now, Josh. Put your arms out to the sides. Now, this is a really important adjustment for him because the ribs attached to the vertebrae in the thoracic spine, if they're misaligned and curved, they're also going to be misaligned up here where it attaches to his sternum. So we're going to adjust his AC joints in his shoulders, his clavicle where it attaches to the sternum, and then his costosternal joints up front, which will also help the costovertebral joints in the rear get better as well. There we go. Good. Okay, relax your leg. There you go. Oh yeah, that was good. There we go. Let this go. There we go. Good. Okay, let's sit you up, face this way towards Joseph. Now we're just getting started with Josh's treatment. Once we get his films, we're gonna blank out all the HIPAA data on it, and we'll show you his x-rays with his permission. And you'll see further what I'm talking about with the functional versus pathological scoliosis. And I think Josh can tell you, I'll let him tell you in his own words after we get done here. After each one of his chiropractic adjustments here, he seems to be leaving here in a whole lot less pain than he walked in the doors. But I'll let him tell you that for his own words. These are all unscripted videos too. We never tell our patients what to say, or they don't even know what's going to happen. Just stand up here and do your cervical adjustment. Okay, let's flex your head forward and backwards again. Now see, that's already better alignment and range of motion. Take a look. See, you're more centered already everywhere. But we're going to keep pulling these guys up and back, flaring these guys here. I'm still going to bring that head straight back and up like this. And now I want you to shift your pelvis straight right. Yep. Hold that right there. Okay, good. Now let's see if that feels any smoother this time. Looks great. You're looking like one of our normal aligned patients right now.
I feel great.
So, would you mind sharing with our YouTube subscribers? I mean, you came in here in really pretty severe pain, didn't you?
Oh yeah.
On I think a 1 to 10 scale, 10 being so bad you're crying in pain or you should be in the hospital. You were up there in the 6 to 8 range, 7 to 8 range in a lot of areas. And how are you feeling after your adjustments each time?
Every time whenever I come in here, I have very intense pain in my lower back and neck, and every time I come out of here, I feel like a new man. I feel great.
And do you feel like your spine's getting straighter as we're doing this?
Oh yeah.
I mean, do you feel like you're standing up taller and with better posture? Great. So you've been dealing with this for how many years now?
Probably about 6 years, 7 years.
That you felt the symptoms going on. You probably had this your whole life and growing up with it and didn't even realize it.
Yeah.
But he's 17 years old now. It's a great time for him to be under care, and we're very happy that he chose Advanced Chiropractic Relief to do that, and we hope that you do too. Just give us a call at 281-405-2611 or go to advancedhoustonchiropractor.com, and Renee will get the email and set you up with an appointment. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief with Josh. Is getting well from his scoliosis. And we'll see you next time.